My name is Tiffany Henry, Williston State College, and I'm going to be demonstrating blood transfusion. Okay, so I'm with my provider right now, and he just handed me orders as well as a consent form and the information sheet for the patient. And I'm verifying with him that we are going to transfuse 2 units of packed red blood cells now to Samantha Lewis. Date of birth 6/10/75, and he says yes. So I am going to go into the bedroom and get all my supplies. And I'm going to go to the patient's room. Knock, knock. I'm going to provide privacy. Good morning, Samantha. How are you today? Good. Could you please do me a favor? My name is Tiffany. I'm going to be your nurse today. Could you please tell me your name and date of birth? Samantha Lewis, she's 43. Date of birth is 6/10/75. That matches Samantha Lewis, 6/10/75. And she says she's allergic to codeine. And on here it also says allergic to codeine. Okay, Samantha, so it looks like the doctor has ordered to transfuse 2 units of packed red blood cells due to your anemia. Has he been in to talk to you? He has. Okay, so he explained the procedure? Good. Do you have any questions for me? No? Okay, so I just want to let you know, one of the things we need to watch for when we do this is if you have any chills, fever, back pain, shortness of breath, it's something you're going to need to tell me immediately, okay? Okay, because then I can stop the blood transfusion, all right? Okay, so I have some information for you. And the information sheet, it's basic information of why you need the transfusion, what the risks are. So I'm gonna have you look over this, okay? And then I also have your consent form. If you could please sign that for me. Perfect, and then I'm signing stating that I witnessed it. We have the consent form signed.
Yep.
Okay. All right, Samantha, real quick, I'm going to perform hand hygiene, and I'm going to put some gloves on. All right, Samantha, I'm going to take your vitals real quick. Okay, so I've taken her vitals. I've gotten her temperature. It's 97.5. We want to make sure that the temperature doesn't rise or fall 1 to 2 degrees, or we won't be able to do the administration, I guess, okay. And I'm going to now assess her site. And I'm looking, and there's no redness, no infiltration, no phlebitis. It looks good. It looks like it is an 18 gauge catheter, and that's good. We want 18 or 20 because if we have anything smaller, it could lyse the blood. So I'm going to go ahead and make sure that her line is patent. And I'm going to clean this 15 to 30 seconds. And we're going to flush the line. And I'm going to feel right here as we flush. And I can feel the fluids moving through. I have no resistance. Looks like we have good patency. Take that off. Perfect. Okay. Samantha, do you have any questions for me at the moment? No? Okay, perfect. I'm going to let you look over this paperwork while I go down to the blood bank and get your blood, okay? Oh, before I do that, actually, I want to prime the lines and have this ready. Okay, so we're going to some tubing. And my tubing is good. There's no expiration on it. I mean, the expiration's good. And I've got my 250 mils of normal saline, and the expiration's good. I have compared this to my MAR, and it matches. And it's clear, no infiltration, or excuse me, no particles. The bag is no leaks. So what I'm gonna do is undo this. And I'll get my sticker over here that is already dated with the time, date, and my initials. And I want to make sure that everything on this is closed. Okay, so we have it closed. And I'm looking for my ends with the spike. And I'm gonna undo this. Take this top off, making sure not to touch it, because we want to keep it sterile while we spike the bag. Okay, so my bag is spiked. I'm going to go ahead and hang the bag, holding this up so it doesn't touch the ground. And I am now going to prime my line. I'm going to open this, and I'm going to fill the filter chamber. And right about there. And then I'm going to go ahead and I'm going to open this bottom one, taking off this cap. And we're gonna let it through and get all the air out, priming the line. And all my air bubbles are out, which is good. We're gonna go ahead and recap this carefully. And I'm just gonna hang this up here. And I'm also going to label my tubing. Okay, Samantha, I'm gonna run to the blood bank and I will be right back, okay? So I'm going to take off my gloves, perform hand hygiene. I'm going to don new gloves since I'm gonna go get the blood from the blood bank. I'm taking my sticker, and I'm also taking my doctor's orders, and I'm gonna head to the blood bank. Whew. Okay, so I'm in the blood bank. And I'm letting them know that the doctor has orders to transfuse I need 2 units of red blood cells. And it's for Samantha Lewis, date of birth 6/10/75. Okay, so she's brought me the blood, and now we're going to confirm together from a unit tag to the sticker. And we have Samantha Lewis. Samantha Lewis, donor number is 120708. 120708. Her date of birth is 6/10/75. 6/10/75. And the medical record PCS 78500. Medical record PCS 78500. The blood band ID is A as in Apple, F as in Frank, N as in Nancy 3889. I have A as in Apple, F as in Frank, N as in Nancy 3889. And the patient's blood type is B positive. And patient's blood type is B positive. The physician is Dr. Andelin. Dr. Andelin, the donor is B positive. So those match. We have compatibility is yes. They have yes. And we have the cross match expires 11/30. Expires 11/30. Perfect. Okay, so I'm now going to take my blood and I'm going to inspect the blood, making sure that the bag has no holes. I don't want to shake the bag because we could lyse the red blood cells in there. There's no particles. It looks good. And so now I'm going to go back to the patient's room. Knock on the door, provide privacy. Okay, Samantha, we are going to do your blood, and I am going to change gloves. I'm going to perform a hand hygiene. I'm going to don new gloves. All right, Samantha, I need you again to please confirm your name and date of birth for me. Samantha Lewis, 61075. Samantha Lewis, 61075. I'm also going to get a second nurse, and I'm going to verify with that second nurse. Second nurse.
Yes.
I need to verify. Okay, so we have Samantha Lewis.
Samantha Lewis,
Date of birth is 61075.
61075.
Blood band ID is A as in Apple, F as in Frank, N as in Nancy, 3889.
Yep, AFN 3889.
And we're going to confirm that to her band, which is A as in Apple, F as in Frank, N as in Nancy, 3889.
AFN 3889. Yep.
Perfect. And her blood type is B positive,
Yep, B positive.
and the donor is B positive.
Donors B positive.
And we have an expiration date of 11/30/20.
Yep. Oh, expiration date 11/30/20. That is verified.
Perfect, thank you.
You're welcome.
Okay. Okay, Samantha, so now what I'm going to do, I'm going to hang this up here. Okay, and I am going to actually, to spike it, I'm going to do it this way. Take this top off. I'm going to take the top off of this. We are going to close this. And I'm going to spike the bag. And now I'm going to prime. And everything else is closed. I'm going to open this up. Ooh. And I'm going to squeeze the chamber. Getting some blood in there. And then, okay. I want to get the blood just down to here because we don't want to waste any blood products. So I am going to take this top off again. I'm going to slowly open this line and I'm going to watch it come down and then stop it before we get to the very end. And I can see it coming down. And we just passed through here. And we are right at the end. Perfect. So I'm gonna close this back up. And get another wipe. We're gonna sterilize or clean this for 15 to 30 seconds. And Samantha, can you real quick again give me your name and date of birth? Samantha Lewis, 61075. And that matches my doctor's orders in her MAR, as well as Samantha Lewis, 61075. Okay, so I'm gonna go ahead and hook her up. Okay, and now what I want to do is I'm going to open this. I've got the saline, or the normal saline is closed, and that is so that it doesn't back up back into the saline. And I want to set this at a rate of 25 to 50 mils an hour, which is gonna be about 15 to 20 drips. Because we wanna start slow just to make sure that she doesn't have any kind of reactions. So I'm gonna kind of open this slowly till we get some drips. Open that. Okay. And we've got our drips, slow drips. I'm gonna slow it down just a little bit. Okay, slowing that down, making sure we have just for the first 15 minutes. Okay. Okay, Samantha, what I need you to do is if you have any, again, signs or symptoms of shortness of breath, fever, chills, back pain, you need to let me know right away so that I can go ahead and stop the transfusion, okay? Perfect, okay. So I'm gonna stay with Samantha for 15 minutes just to make sure that she tolerates this good. While I'm in the room, I'm going to go ahead, I'm gonna document the amount of saline that was started. I'm gonna document the start time. I'm going to document the blood type, the RH factor, the date and the time. We're going to tolerate the assessment of her line, that she has no phlebitis, no inflammation, everything looked good, that it flushed good. I'm going to document my name and that I'm gonna hang out with her. And how are you feeling? Good? Okay, well, it's been 15 minutes, so now I'm gonna go ahead and I'm gonna retake her vitals. And everything's good, 97.5. Blood pressure's good. She's breathing well. So I'm gonna go ahead and step out of the room for a minute, and I will be back if you don't have any questions. I'm gonna take off my gloves. I'm gonna perform hand hygiene. I'm gonna step out of the room, and I will check on her about every 30 minutes just to make sure. I'm actually gonna go back in to the room after 30 minutes. I wanna see how she's doing. She is good, so since everything's tolerated, I'm gonna go ahead and turn this up to 150 to 300 mils an hour. We wanna make sure that this is transfused within 4 hours because we don't want sepsis or anything like that. So we're turning up her line. Perfect. Okay, so I've left the room, performed hand hygiene, taken off my gloves. Time has passed. I am now gonna go back in because the infusion should be done. It's been a couple hours. How are we doing, Samantha? Good? Could you please confirm your name and date of birth again? Samantha Lewis, 61075. Samantha Lewis, 61075. Okay. I know we ask a lot. We just have to make sure we have the proper patient. So all of her blood has been transfused. So I'm going to go ahead and close this. And I'm going to go ahead and I'm going to open up the normal saline so that we can flush the line, as well as making sure that it flushes through her IV catheter, making sure she gets all the blood, and that the line is clear and she has everything she needs. Okay, so it's been about 10 minutes. While that's infusing, I am now documenting the stop time. I am documenting again how she tolerated it. I'm gonna document her vitals, and I'm going to document an assessment on her site again, that there is no redness, no phlebitis, no infiltration. And do you have any questions for me? No? Okay, so since everything has gone through, I'm gonna close this up. I'm gonna close this up. I'm going to disconnect her. I am going to take these off, and these are gonna get disposed into a biohazard bag. I'm going to take off my gloves. I'm going to perform hand hygiene. Also, Samantha, just to let you know, the lab is gonna come in about an hour. And they're going to go ahead and they're gonna draw some more blood from you so that they can do a hemoglobin and hematocrit, okay? Just to check and make sure everything's good. You're feeling better? That's awesome. Okay, so before I leave the room, I'm gonna take her vitals just one more time just to make sure everything's good. Her O2 is actually up to about 96, and her temperature is perfect, 97.5, and blood pressure and vitals, everything is good. So again, I will document all that. And since she has no questions, I'm gonna go ahead, perform hand hygiene, and I'm gonna leave the room.